Hi, everybody. All right. Today, I've got another interesting topic for you. It's called Sex Problem and Solutions, Part 3. Part 1. Your sexual anatomy determines your sexual orgasm. Did you hear me? I think that's the coolest thing ever. All right? I don't think a lot of us knew that your sexual orgasm, that powerful orgasm that you have, is determined partly by the anatomy of your sexual organ. Okay, so your sexual organ, male, and your sexual organ, female, is unique. I said it before. We talked about how the vulva, how the vagina has so many shapes, thousands of shapes, and we can see that at the museum in New York, coming to Miami soon, right? We're going to go see that soon. I'm going to go see that with you guys, okay? But you'll be surprised that the male shape of the penis and the female shape of their vagina and vulva, remember, the clitoris, all that stuff, determines how and if they have an orgasm. Okay, so we know what the orgasm is. We talked about it before. It's where, right, you have this complex cascade of reactions in the body, right? After some stimulation, and then suddenly your whole body starts to just engorge and get excited, and your heart rate goes up, physiological responses occur, and you are suddenly in the zone, and then you have that peak where you actually, for the guy, ejaculate, right? You get erect, you ejaculate, you have your orgasm. For the woman, we go through all these complex phases, and then we also have our orgasm, right? So, depending on a few things, you can actually have more orgasms, multiple orgasms, men and women. About 7% of men have multiple orgasms. Women, there are quite a few women that do have multiple orgasms. When I say quite a few, about 20%, 10, 20% in the world. But you've got to remember that it depends on your anatomy, depends on how you're born, okay? So the anatomy, the physiology, the psyche, your upbringing all affects how you're going to have that orgasm and whether you can have an orgasm, because sometimes it'll affect you, right? What you've been through, right? How you were brought up, and then your anatomy. So let's talk about your anatomy today. We're going to talk about your anatomy. Your anatomy can affect whether you are going to have the orgasm. Okay, I'm going to land. I know it's just exciting because I want you to understand it's not new, but it's not talked about. Okay, so let's go from the guy to the girl to the guy to the girl to the guy to the girl. Okay, so the guys, we already know about the size of the penis, right? The question now is, are you having better orgasms, guys, with a bigger penis? Studies are not really clear about that because it's so subjective, right? It's so hard to say, okay, what degree of the orgasm did you have today, sir? It's hard to ask that question. But there are some tools out there that can subjectively ask, questions in terms of, did you have the best orgasm of your life, or was it so-so, or it was okay? So we need to know how to grade it, but we don't have a standardized way of grading our orgasms for the guys. For the women, we do have something called an orgasmometer, an organometer. That organometer is something that uses, again, subjective smiley faces like we use for pain to tell me whether you're having great sex, which is nice smiley face, red, nice, or whether it's sort of like not so great, it's a 0 and there's a frown face, right? So you've got these ways of telling with the organometer whether you're actually having this great sexual function and reaction for the women. For the guys, it's not as clear because you guys have it much easier. I mean, it's much easier for you to have the orgasm. For the women, it's more complicated. So the size of your penis, we're not sure. But some people do suspect the bigger the penis, the bigger the orgasm. Not confirmed, so don't quote me. The smaller the penis, the smaller the orgasm. Okay? That's the general consensus, but we're not sure because we haven't had extensive studies. Okay? But I can tell you, with the clitoris, the bigger the clitoris, the bigger the orgasm. Yeah. The bigger the clitoris, the bigger the orgasm. Still, some more studies need to be done on that, but some studies have said the bigger the clitoris, the bigger the orgasm. And I mean in terms of intensity. Okay? Now, does that mean if you have a small, non-existent, very small, tiny little clitoris, you're not going to have an orgasm? You could, but the question is it as intense? Is it as big as someone that has a bigger clitoris? And I know the big clitoris can be sometimes intimidating for the guys, and it depends on, so many different factors that can make that clitoris big, right? Genetics, and again, how you're born, and medications and drugs, right? But what you want to know is, depending on the size, it can affect your orgasm, ladies, okay? And guys, it can too. Now, did you know that the penis is basically our clitoris? So the penis and the clitoris basically are the same shapes and almost same anatomy, right? It's just that we're much smaller with the clitoris compared to the penis, right? But you still have the same tissues involved there. I'm not going to go into that, but just know that the clitoris and the penis are pretty much the same. So when you guys love oral sex, which I know you guys love, women love oral sex too, right? Because the oral sex does the same thing to us as it does to you when we do it to you. So guys know that when you have oral sex, all that different variations, the top of the mouth, the bottom of the mouth, right? The tongue, the side of the cheek, right? The back of the throat, all those different sensations drive you guys crazy. For those that do oral sex, if you don't, this is not for you, close your ears. But for those that do partake in oral sex, guys, you know you love it, right? The vagina, contrary to the mouth, is one muscle, right? It's still a beautiful muscle, especially if it's tight, but it gives you a different sensation as compared to the oral stimulation, right? For guys. Women, same thing. We love the clitoris being stimulated, being, I'm going to say, gently stimulated, because we don't want it too strong. Again, each person is different. Each one is different. So you've got to find out what that different pressure is, what that different sensation that they like is, whether it's a feathery touch or whether it's more of a rubby, hard touch. You got to just figure it out, right, guys? I know it's not easy, but you gently talk to your partner, ask your partner, hey, what do you like? You like this? You like that? What you prefer, right? And you just whisper in her ears and she'll tell you, and you'll tell yourself when you see her response. So do not forget that the clitoris is just the same as your penis. So just think, if you want her to make you happy by doing oral sex, make her happy by doing oral sex, okay? And focus on getting that clitoris nicely stimulated. So that is important to know, that the size does matter for both, right? Vagina size also, right? So depending on how long or how far the cervix is, or how short the vagina is, or how wide, or how strong the pelvic muscles are, that can also make you have that orgasm the stronger it is, right? So if you have a very short vagina, you might not have the best orgasm because you don't really have a lot of muscle there, right? So you got to be careful. You got to find out, is that your issue? Again, we'll talk at the end whether there are things we can do to improve that. But the most important thing is, what is your anatomy, okay? There is another point I want to make, and this is for women. They say that women that have frequent orgasms, all right, that the clitoris is actually close to their urethra, okay? So, the clitoris is here, the urethra, which is where the pee comes out, and then the vagina, right? They say the closer they are, the easier the orgasm. Isn't that cool? All right, so yeah, 2.5 centimeters. If it's more than 2.5 centimeters away, it's gonna be hard to have that orgasm. I want it less than 2.5 centimeters. Now, how can I make that happen? Because you were born like that, right, ladies? So check it out. Are you 2.5 centimeters away from the clitoris to the vagina? That's not very good. It's too far. Now, clitoris to the urethra, then the urethra to the vagina. So you want to make sure that that distance is narrow. Now, again, if it's more than 2.5 from the vagina, from the clitoris to the urethra, that's a problem. That's what studies show. Okay. So check it out. Is it possible that that is why you're not able to have that great orgasm? Is it a problem? You got to find out, right? If you don't know how to do it, come to a doctor like me that knows how to check it out to make sure that the distance is not too far away. Can you do something about it? Absolutely. All right. We'll talk about that at the end of the talk, right? So you know that we have the female orgasm and we have the male orgasm. So just remember for the guy, right? You have the erection, you have the ejaculation, and the orgasm. So some guys, don't actually, have to orgasm, right? And some guys don't actually have to ejaculate with orgasm. So that's something that you got to know. Women, men, you got to know that, right? So sometimes you'll have that orgasm and it's like, yeah, you had a little bit of an ejaculation or you didn't have any ejaculation. Men do have orgasms without ejaculation. All right. And then the question is, can you have an ejaculation without an orgasm? Most of the time they come close together. They really do happen pretty frequently like that. And it's easy for you guys. Most of the time, no problem. So the anatomy there would be more of your innervation, your nerves, your sympathetic and parasympathetic nervous system. So I don't want to go into that too much. But if you have a bad or poor nerve supply to your organs, guys, you're going to have a hard time having that ejaculation and that orgasm together, right? So the sensation matters. So if you've got a poor sensation, it's not going to have a great ejaculation, great orgasm. The more circulation you have, the more sensitivity you have, the better. Okay, so the question now is, were you born with a good circulation? Were you born with a good sensation? Were you born with good nerves or not? And guess what's the easiest way to find out? I am very much into, are you sensitive around the nipples? Are you sensitive around the anus? If you're not, you don't have the greatest innervation, which means your nerves are not the best. Now, there are no studies for that. This is just an observation I've made through the years, through talking with my patients and trying to fix sexual issues, sexual disorders. You'll find that when guys don't have any sensation around the nipples or around the anal area, and you don't have to be gay, you're not gay if you have sensation there, guys. Just know that. You are absolutely not gay. It's just a nice added erogenous zone, right? So just know that if you don't have sensation, you might have a decreased sensation and might make it more difficult for you to have that orgasm. Maybe, not all the time. You guys can have your orgasm, but imagine if you had more sensation, you're gonna have a bigger orgasm, okay? All right. Women, same thing. If you have a poor innervation, a poor nervous supply to the clitoris, to the vagina, it might make it hard for you to have that orgasm, right? Now, there are studies that show that women that have had accidents and men that have accidents, they can still have their orgasms, even though they've affected the nerves. Even childbirth sometimes will affect your orgasm because the nerves being affected or not. It all depends on which nerves. I don't want to go into the details, but there are treatments that you can get to help innervate and stimulate your nerves to get them a little bit more awakened so that you can have a better orgasm. Now, there are, contrary to that, people that have too much sensitivity to pain, and then they have that pain with sex, right? So then you got to be careful and get treated for that. There's a different treatment for that. So again, if you're born with a lot of nerves, you could be hypersensitive, and that will affect your orgasm. You're not going to want to have sex, right? And that's what we call, some people call it dyspareunia, pain with sex, but most of the time we call it vaginismus, painful sex, okay? Pain with sex for women. So if you're born like that, it's going to affect your orgasm. So guys too, we know we have the premature ejaculation. If you're too sensitive, you're going to get that premature ejaculation, which we don't want, right? So we can get that addressed too. So no, there's an answer for that too. Okay, so generally for guys, if you are able to balance your nerves, your circulation by having a great blood pressure, great heart, great respiration, great health, you exercise, you eat well, all that stuff is part of your autonomic nervous system. So your autonomic nervous system is very important. The sympathetic and parasympathetic, that balance for you guys, you've got to keep it nice and strong. How do you do that? Exercise, diet, get that physical, make sure you're healthy. Women, same thing, but we're a little bit more complicated because we actually have so many other things. Our mind is there, right? The brain is so sensitive for women. We start thinking and worrying, and we have our complexes and our cultural upbringing and our, social upbringing. And it's just, are we going to have that orgasm? We're scared. It affects us so much more, even though I know it affects guys too. Anxiety on both sides really, really kills it, right? So we want to make sure that you actually have not only a good innervation, but you're taking care of your health to keep and maintain that innervation, to keep those good nerves, okay? All right, so For guys, your mental health is very important, right? So if you're born with, let's say, schizophrenia, right? You got to be careful. It's going to affect your sexual function, right? So you've got to reach out. If you're taking medications, you got to reach out, get some help. There are treatments that we can give to counteract those medications or antidepressants that do take away your orgasm for some guys, not everybody. So reach out again to a doctor like me, find out what those are if you're having that problem, okay? I do also want to point out that the more sex you have, guys and girls, you decrease stress. Okay, so even though you might be stressed out, you decrease your stress, you improve your blood pressure. Okay, studies show you improve your blood pressure, which is leading to a better quality of life and longevity. You live longer. I've said 2 orgasms a week, you live longer. Don't forget. Okay, now for the women again, it's a little bit more complex, but I do want to point out a few things again for the anatomy for women. The clitoris needs to be stimulated during sexual intercourse, right? Even masturbation, right? You stimulate the clitoris, and you get a lot of uh, stimulation and a lot of responses physiologically when you do that. Your mind, your 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 soul, right? And you start producing all these chemicals and these reactions where you start to get aroused, right? And you're getting that engorgement, right, to the groin, women, right? So if you don't have a strong muscle in the groin, meaning for some reason you had some either born with some weaker muscles compared to women that have stronger muscles. Again, Kegel exercises, hint, hint, for guys and girls, Kegel exercises all the time, every day, at least 100 a day, 50 in the morning, 50 at night. Keep those muscles nice and tight and strong. You really need to know whether you are keeping those muscles tight or whether they're loose. Leaking urine for women, that will be a clue that they're loose, all right? Those muscles need to be tightened again, okay? For that, see your Euro-GYN, let's get that evaluated. We might have to do some physical therapy for that. And they do have physical therapy to strengthen those floor muscles, right? So just go and get it checked. If you have a prolapse, please go get it checked. They can tighten that thing right, good for you. So it's nice and tight, okay? The G-spot, I cannot forget the G-spot, right? In women, the G-spot can vary. Again, if you're born with a G-spot, that is not that great. And again, there's, what is the G-spot? It's that area that is in the first inch or inch and a half anterior at the top of the vagina, where you actually have that little softness. You can feel it. Women, you can feel it. Guys, learn to find it, right? And the ultimate game plan is when you're in your relationship sexually, intercourse or toys, you want to get that spot hit. And guys, I'll tell you later on, next topic or next talk, how you can get there. And I'm sure some of you already know that, how to find that G-spot. But you've got to get there and get that spot and find it, and she will have that orgasm with the clitoral stimulation. Don't forget, they go together, okay? But that G-spot, again, they say that the clitoris, actually when it gets aroused, when it gets big, I remember my clitoris, I didn't bring my model, but I showed it to you last time. Go back to my previous talks. The clitoris is big and it does come down to the vagina. And they say that that clitoris, when it gets engorged, gets nice and aroused, it does hit that G-spot from inside. So if you guys, men, can get that G-spot by hitting it with your penis, getting that anterior 1.5 inches, knowing where it is, you can actually have her have that orgasm much easier, especially if it's a place that she knows when you hit that spot, it works all the time. But again, if anatomy-wise you have a poor innervation or the clitoris is not getting aroused and it can't get down there, you're not going to be able to feel that G-spot. So you got to get aroused when you're feeling it, and then you'll know where it is. It's nice and soft, okay? And you'll feel that innervation there, okay? So you definitely have to be aware that the clitoris does get close to that G-spot too. Studies show that, okay? I do want you to also, women, know that some women have more nerves in the anterior part of the vagina, and some women have more nerves in the posterior part of the vagina, which means if a guy is going to hit you from behind, you're going to have more of an arousal versus from the front. So depending on whether you have nerves more in the front or back of your vagina, guys, ladies and guys, try and find out, because the position can matter. So you want to hit the position backwards or forward, depending on where that innovation is. So test it out, find out. Some of you will know just by putting your fingers up there and feeling it when you're stimulating yourself. And yes, masturbation is healthy. You've got to masturbate to learn how to orgasm on your own. Of course, not too much, ladies and guys, not too much. It can turn off your interaction with your partner, so not too much. We'll talk about that some other time. But it's important for you to know what turns you on and how your anatomy is by, again, stimulating yourself. And it's, again, very natural. We were all born to touch that area. All animals do that, okay? Then I do want to talk about the treatments, okay? So in a nutshell, there are procedures that we can do to improve the innervation, all right? There are some equipment that we can use to stimulate those nerves. Now, the more the damage to the nerves, the more intense the treatment, okay? I don't want to focus on the treatment right now. That's a lot of information. You should see a doctor to get that information, but I'm going to let you know you can get your nerves improved, guys, okay? And it's not difficult. I might have to have a talk about that on a separate day, but there are ways to do that. And women, same thing, okay? There is equipment, there are tools we can use that will actually improve your nervous supply, okay? Not guaranteeing it, but it improves it. Studies have shown that, okay? The other solution for some people is surgery. Now, I'm going to say surgery very carefully because I don't recommend surgery unless you get the advice of a plastic surgeon that does this sort of surgery, a GYN plastic surgeon that does rejuvenation of the vagina, the vulva. And again, I'm not encouraging it. I'm just saying that there are options if it's that serious. If you want, for example, the measurement between the clitoris, the urethra, and the vagina, if it's that big, there might be some anatomical reason for that, and you want to get some advice from someone like a GYN plastic surgeon that will actually be able to give you the options, whether you can actually bring them together, okay? Just really quick, that was something I want you to know. But you need to be able to see someone, find out solutions regarding the anatomy. But the answer is yes, we can get some fixes there. With medications also, guys and girls, we can reverse the effect of antidepressants by giving you some of the other medicines that will counteract that. Again, not guaranteed, but we do have some reports, studies that show that they can help, okay? All right, so anatomy. Is there anything I'm forgetting? Let's see. I think that covers it. I do want to emphasize that there is nothing wrong with your anatomy. You are who you are, but it might be a clue as to whether you're having great orgasms or not. I know squirting comes to mind when you think of the urethra and you think of how close it is to the clitoris. Just know that squirting can be pathological, I mean, it can be a problem, and then again, it might not be. I do believe in squirting. I do believe that it does exist. Studies show that there's fluid that has been studied, and it's not all urine. So there is some female juices in there. So it's not something that you should negate or frown upon or be scared of. I think it's something that you really should enjoy as long as it's not hurting you or causing any urinary symptoms after that, like pain or frequency later on during the when you're not having sex, right? Or any pain in the pelvic area. So always get that checked out. Okay, guys, I've talked enough. Just wanted you to know about the anatomy of your genitals. It can affect your sexual orgasms. So let's check it out. Go home, find out, do you have the greatest anatomy for sex? And if you do, go for it. And if you don't, come see someone like me to help you out. Okay, guys? All right. Have a good night. Bye.